what are some of the considerations that I should be making when trying to get the vaccine? Like, which one should I pick? How do I know which one to go for, and which one is the most effective for that matter? Do I go for Johnson and Johnson, or do I go for Moderna? What are some of the things to consider? Thank you.
Z with the great questions. Um, so I think what you should consider is your personal situation. You should think about your own health. Think about the health and well-being of those who you love and those who you care about, um, and then consider how being infected with the virus might impact you. If you're thinking about your personal situation, how being infected with the virus might affect those you love and care for and live with, how it might impact them. And then I would ask people to consider what that being infected with COVID-19 doesn't end after a 14-day quarantine necessarily. Not everyone experiences COVID and just gets to stay home for 2 weeks without any symptoms. Many people really suffer with it. We've lived, through a year and a half so far where a lot of people have gotten really sick, have been hospitalized, have been in ICU on breathing machines, have died. People lost family members. Those who survived, still have what we call like long COVID. So still symptoms that last beyond the COVID diagnosis. So thinking about or considering that your situation, that situation of those you love and care for, and then what it would mean for your life to change dramatically if you were to be infected with the virus, and really just making an informed decision. So if you're, listening to people that you trust, looking for information that you find reliable, and then having these types of conversations to get yourself to a place of comfort so you can make the best decision for yourself, your family, and then ultimately the larger community. When hopefully you decide to get vaccinated. I think no matter which of the vaccines you choose, you can't really make a wrong decision there. Because if you don't choose any of them, you're leaving yourself fully unprotected from the COVID-19 virus.